Okay, why don't we go ahead? So welcome and welcome back. We're delighted that you've come back today. Um, but seriously, in reflection, last night, I was delighted with the progress that the group has made. And one of the things that I'm very impressed with is that, uh, uh, given that we were all strangers at the beginning, we know many more people's names. Speaking as somebody who's not particularly good at names. But what I really mean there is that we've actually, over several workshops, have gotten to understand where people can come from, and that understanding is the basis of moving forward. And I also hear in the group a sense that we need to move forward and move on with kind of the issues of, all right, these are wonderful ideas and great programs. How do you spread? How do you grow? How do you both build on opportunities and address the challenges? And that's where we are today. Before I do that, though, I want to embarrass some people in public. So I'd actually like to acknowledge our colleagues on the program committee. Patricia said this was the program committee that was just not fated, because whenever we wanted to meet, there was a storm of something. So we did a lot of work virtually, and Susan and I wanted to acknowledge, and not quite everybody's in the room, but Virginia and Donna. If you could just raise your hands, Donna, the members of the program committee, and then Gillian, are you in the room? Kathy, Stephen, Shannon. And Marika is our consultant. And do we got everybody? Good. There's a name here I can't read on my own handwriting, which is... So to all of you, thank you very much. This is one of those cases where the net product is much better than any individual, so thank you. And three of them actually are going to be very involved right now. So let me tell you what we're looking for. You have the wonderful amount of time of 2 hours to go into a deep dive in three areas. When I end up speaking here, I'm going to ask Megan to sort of direct you to the specific rooms. The webinar will take place in this room, and the three smaller groups will be, I think, all on this floor. But let me tell you what we're looking for from this. If our overall goal is how do you scale and how do you spread these innovations in community-based health education, these three cases allow you to go into a deep dive into a specific example. And they're of different flavors, and so let me go into them. One will be the community college system, which is what's the best way, how are community colleges organized, what's the best way to develop collaborations across institution as a kind of a key structure to that. A second is student-run clinics, and Donna's going to be facilitating that discussion. A second one is Kathy Kalasa is going to be leading, is on student-run clinics, giving a couple of examples. And then Virginia as kind of a project in becoming, in which it's almost a focus group about how to set it up and move it forward. But for each of these cases, what I want the group to come out with is kind of three general areas. One is exactly what is the innovation? What do we all need to know about this? What is it about community colleges or other things that is important for all of us as we think about spreading and scaling? But then the next question is to get into the gritty details of how does this work? And gritty details are not what academics like to deal with. We like to deal with curriculum. But what drives things is actually where does the money come from? Who's going to be the leader? How are you going to, what are the metrics you're going to use to see whether or not you've had success? And critically, after the initial enthusiasm that's runs out, how's it going to be sustained? So for each one of these, begin thinking about that. And then the last part of your discussion is that, and we'll have more at the end of this morning, is the issue of, all right, what does it mean when we think about the general question of scaling up and spreading? What are the general lessons? In our workshops over time, we've had a lot of wonderful models from all the different disciplines. And it's the sort of thing that, at least the way my mind works, the more examples you have, the better. But we also need, inductively, if you will, begin to understand how do you begin to spread this? And so what are the general lessons about spreading and scaling? Those are both opportunities and challenges as we begin to try to generalize across the professions and across the continuum of care. So with that, I'm going to turn it over to Megan. The webinar will take place in about 5 minutes here. As a general operating plea, when you speak, get close to the microphone, both later today and others, because at least I am beginning to get hard of hearing, and I really need the help. So thank you very much. And Megan, you're going to give us our stage directions.
Yes. Hi, good morning, everyone. So first of all, if we have the actual assignments for breakout groups coming soon, but if you are a 4-member alternate who pre-selected your group, you got your first choice, so you can just head straight to that room. The groups are, the first one, Community Colleges, a model for spreading community-based IPE. That's in room 101, which is the overflow room. If you walked by it, it's right over this way. Scaling up community-based interprofessional, faculty-run, and faculty-assisted student-run clinics. That's in 105, which is on this hallway over here. And interprofessional education, preparing law enforcement and health professions together, is in 106, which is also on this hallway over here. So for our members and alternates, we've got the assignments. As I said, they're forthcoming. Hannah, who's right back here, she's got them if you're unsure where you're going. Assignments are also posted on the doors. And for general participants, please feel free to go to any room that you would like, up to the capacity of that room. Any questions?
And come back here. There'll be a break at 10:45.
Yes.
And then
thank you for saying that. There'll be a break at 10:45. Please do note we are having a webcast session in this room. So if you could try to keep your voices down outside if this session is still going, we'd appreciate that.
Thank you very much, Megan. So you'd like us to get there now?